Yeah, yeah. I've never. What if I just shot
Gotta
that down? Yeah.
gotta get your consent, you know. But anyway, that oops. See, that's what happened with technology. Don't let this happen during your presentation or tomorrow, okay? While we were so we watched the sales pitch that you and Sarah did. It was pretty impressive. We had a little understanding about what you guys do. Seem like you guys are trying to like provide a platform that would help organizations to better do a better screening process, right? So
right.
like so if I'm a patient, I go to let's say, I'm just making this up, a doctor office, and then the doctor office, they will let me use like log, for example, sign up an account and then try to answer some questionnaire that which would help them to determine like my health level or something like that. Would you maybe like go a little bit more in depth about how your company operates and stuff, and we can go from there, please?
Sure, absolutely. And there have also been a few changes since we recorded that video, because we got like more feedback from the judges and from the NVC. So let me like try and explain like what we're trying to do. So currently what we're trying to do is, so we are a preventative platform, and what we do is we would be providing screenings to the patient. We'll be constantly, it would be like a preventative health care narrative, a navigation, wherein they would be prompted to take the health screenings, and they have to take the health screenings. We have like mostly cancer screenings right now, and we would be piloting with colon cancer screening. And once they take the screening would be based on their age and gender. So for example, if they are males and they are above 45, then they're eligible to do colon screening. And we would also ask more questions about their family history. So for example, if somebody in their family has a colon cancer history, then they are more likely to develop that cancer. So we would be asking those questions in a very narrative format, like a chatbot, wherein they feel more comfortable. And then based on that, we would recommend them like, hey, you need a colonoscopy, or you are due for a at-home screening test. And then the patient has the option to either go ahead and schedule the colonoscopy with a PCP if they have one. And if they do not have a PCP, then they have an option to elect a PCP through our platform. And if they want to order the at-home kit, then they can just go ahead and order it through our platform. It would be delivered to them with the instructions of how to do it and everything. And then a provider from our platform would follow up with them. And what we are trying to do right now is we're trying to bundle up this integration module with the employee benefits portal. So something that you just get via your company, and the firm would be nudging the employee to complete their screenings. And what this would do is this would result in better, lower costs for the employer, and less days lost in productivity. So this is what the final idea is. So we would be like a B2B platform. B2B as in we would be selling to benefits managers. Yeah.
I see. Okay, I see.
Yeah.
I see the nuances here. So now you guys are, if I'm understanding correct, you guys are focused on essentially the employers, and having different employers utilize this platform to have their employees to do such survey, or complete a list of questionnaire, and which as a result, this will be serving as a preventative control for the company. So for example, if maybe one person may have such condition and stuff like that, through a series of action that is taken by the employee later on, that will save the company some money, right?
That is right. Absolutely.
Okay.
Yeah.
Okay. So are you guys still working with
Work with this one, so you can guide.
Right. Okay, you just for your knowledge, you look good on both, Neha. But anyway, so right now, are you guys still focusing on like doctor office, like large like health organizations, or are you guys more focused on like the employers?
Yeah, the feedback that we got was like to focus more on employers, and in the
Okay.
long run, maybe like partner with providers. So we do have like a few partnerships lined up with other big companies that like our co-founders work for. But for NVC, I don't think we will be focusing on those kind of partnerships right now because the investors and judges don't think that's a good idea.
Okay. Yeah, I can in a way, I think, yeah, there are definitely more potentials there, because in a way, I think as a company, like as an employer, I'm able to see my investment in maybe, like a few months. Oh, like if the employee haven't done ABC action, then maybe I have to put so much money on my health expense for my employees. Now it's because of this, some upfront investment, I'm able to get some sort of return.
Exactly. The ROI on it is like really high. That's number one, because I was reading a few papers and it costs like $2.34 to have like this kind of inclusion for each of their employees, but their benefits are much more, because like most of the employees like together tend to lose about 1.4 billion days in productivity. And that's a lot, like 1.4 billion days.
Yeah, for sure. I remember see some similar articles in the past, how just small change in organization, for example, promoting people to take some walks during the day, will literally save company tremendous money. Like something that we couldn't even think, what?
Yeah.
But actually, yeah.
No, absolutely. And another metric is that, like, for an employee who does not have cancer, it costs them about $3,000 a year, whereas for somebody with cancer, it's like $16,000. So that's much more than like 5 times.
Yeah, Neha, I'm curious, can you kind of speak to, for somebody like myself, who doesn't come from a background in healthcare, can you kind of speak to like, what's the sort of like environment around these? So like, are there a bunch of competitors sort of trying to, bring this sort of, streamlined sort of like, like using nudges and sort of like psychology research to do kind of exactly what you're saying? Like, can you kind of give us a sense of like what other actors are working in this space to try and like solve similar problems to what you're doing?
Sure. So there are like a few companies in the space. There's Castlight, and I think Sarah would have been able to speak more to this. But yeah, she's not here, so I'll speak as much as I can. I'm not from healthcare background myself. I'm a software engineer, so
okay. We're all in this together then.
Yeah.
Yeah. I had the option to take a healthcare econ class in undergrad, and I was like, hell no, that sounds complicated. But I'm sure that's why you're here, so you can explain it to us.
Sure. So there are a few people in the space. There is Castlight, and I'm gonna like go ahead and pull up like a few things that I can think of. Castlight is one that I remember. There is so there is Pulse, there is Vivify, League, and very few actors in the space who actually really are integrated with the employer's portal. There are a lot of them, but they are mostly either telehealth, who are plugged into the benefit portals, but there is no like preventive care solution in the portals. And I think what really differentiates us is that we are also offering this in a multilingual platform, because a lot of like immigrant workers do not really understand they have like cultural barriers to understand it. So offering it in a multilingual platform is something that we we actually had a user survey from about more than 400 plus respondents, and that was one of their barriers that they had, like language. So multilingual platform, I think that's the only one that we are offering that differentiates us. But apart from that, let me see. I'm going to try and see if I can share the screen. This is
Here, let me give you the what do you call that, presenter role. So I think you can share screen that way. Make co-host.
That would be great. Okay. So it's just one of the slides that we're working on. So basically a better representation. Since our what do you say, the stakeholders changed a little bit like this week, we're also kind of, I don't know as much as Sarah knows, because she's worked on this more, but I will go ahead. You guys see my screen?
Yep, perfect. This is
All right. So basically, this is the competition in space. And as you can see, like the multiple languages part that I covered, there are, and then what else? Let me see. This is the thing that differentiates us. And then, yeah, on platform provider care, I think most of these companies just kind of link you to will give you a recommendation, and then you are supposed to follow through with your PCP. But the problem is that most of the people don't really have a PCP, and at least that was one of the things that came up from our surveys, that most of the people don't have PCPs, and if they don't have PCPs, they really don't know how to navigate the system.
Sorry, maybe a silly question.
Mhm.
Neha, didn't mean to interrupt you. What is PCB?
PCP is primary care provider. I'm sorry.
Oh, okay.
Yeah.
Not a problem. Okay.
Yeah. So generally, like when we have like annual screenings every year, or like annual checkup with your primary care provider, like they are supposed to tell you like, hey, you are due for a screening, you're due for a pap smear, you're due for a mammogram. But most of the people, I would not say most, but a huge chunk of people don't have PCPs. And that is definitely a barrier to getting screenings as well. So getting this through your employer, and if like the employer has incentive, like I'm not sure if your employers have this or not, but we have this, at least the company that I work at has this thing that if I complete these screenings, or if I take this test, I'll get like $300 in my MRA, so like there is a lot of incentive to then take those screenings. And you can also, if you've taken those screenings, you can lower your cost for the next year also. So I think those are the kind of things that employers offer. And if this is offered as a part of the employer's package, just more incentive to it.
I see. So a question here is, so let's just say I'm due for I'm just making this up. Don't laugh. Like an eye exam. Okay, I'm due for eye exam. So let's just say I'm working with you guys through my employer, and now 6 months in, I did my exam. Then do I need to log my activity? Oh, I did my exam on the platform so that it track that and maybe remind me 6 months later or something like that.
Yeah, so that is definitely so right now our use case does not cover the eye examination scenario, but say if it did, it would keep nudging you until you got it completed, or you logged that you completed it.
Got it. Okay, yeah, I just try to understand how the system works. Okay.
Yeah.
And
another thing is that a lot of like there's a lot of confusion around like in network and out of network providers, right? And I'm pretty sure all of you have also faced it. Like instead of going to everybody's website and trying to figure it out, what we are going to do is we are going to provide a provider who is in network already. So at least that does like stops like some confusion around that area.
I have a quick question for you. You had mentioned earlier, maybe this might have just been a throwaway part of your guys' pitch, but you had mentioned that you would ship customers certain like test kits. Can you kind of speak to, do you kind of see that being like a significant part of the business, this sort of like you guys also sort of start, because that seems like you also start moving into like not necessarily just an app, then it sounds like there's a whole sort of, you guys have an idea about like fulfilling orders and being some sort of kit, like test kit provider. Can you kind of speak to that?
Sure. So for this test kit provider, there are a lot of screenings which can be done via like at-home screening tests. What it means is basically you would just get like a screening kit, like just like a pregnancy test, or like COVID test where you can just like do it at home, something like that. But we would be partnering with other companies. So there right now, since our pilot is towards colon cancer, there is an at-home screening test for it called Cologuard, with whom we'll be like partnering. So it would probably be like what we are planning to do is like I have like a API integration system with Cologuard's API. So when we place an order, it would actually be placed on Cologuard's website, and they would be handling the ordering. at least
Gotcha.
as of
Okay.
now.
Okay. So it's more of like more of a strategic partnership that you guys are doing to sort of like, okay, gotcha.
That's
Rather
right.
than like, having some sort of like kit, factory somewhere. Okay.
No,
That makes
yeah,
sense.
no,
Yeah.
definitely not. Yeah.
So I mean, I guess I was also, and Rudy, please jump in, if you kind of feel similar, I like this is, it sounds like you guys have like, this looks like you're, from the little thumbnails on the slides, this looks like a fantastic pitch, I mean, it sounds like you guys, got, great opportunities at NVC. I guess I'm kind of wondering, like, what's your sort of traction at right now, and how do you kind of, see, Rudy and myself sort of contributing to, this great project you guys have got going?
Sure, sure. So we basically are looking for a sales toolkit to sell to our benefits managers. And those benefit managers are people like who reside in like the human resources department of companies and are responsible for annually taking what different benefits need to go in this year's package. So those are the people we'll be selling to directly as of now. And this market is pretty huge. So we are looking at targeting the self-insured companies, which make up about, like, I think I should have those stats here as well. It's here. So the health insurance market currently is like $1.2 trillion. And out of that, we are targeting the self-insured companies because those are like big companies which offer like benefit packages to their employees. And that's like about a $804 billion market. And even out of those, the ones that really require preventative screenings are aged between 26 and 65, especially for cancer screening, since we are mostly like focused on cancer for our pilot.
Okay. So definitely, yeah, there's a huge market for that. So currently, is the platform live, or is it to be live in 6 months? Or could you touch a little bit more? I mean, discuss more on that, please.
Sure. So we do have like a platform just to create awareness. We also have implemented the screenings, but they are more in a questionnaire web-based format. Like I said, we had a change in strategy this week and the previous weeks that we've been working on this. Initially, we were supposed to have only a web-based platform, and now we are also going to move to the mobile application. So I would say we have quite a lot of work done, but to pilot, we would probably be another 6 months, and to have like a full launch, it would be 2022.
Okay.
Yeah, I think that is also right here. That might be able to explain it better.
Gotcha. Okay, this is great.
Yeah, and we do have like a website. I'll just put tab.
Okay.
So sorry, you might have just already sort of I might have just missed this, but so what's sort of your guys' status with reaching out to these health and benefit managers at these companies? Have you guys like had any sort of contact with them yet, or is this this project that we're talking about, is that sort of like the launching of this effort for you guys?
We have been in talks with a few of them, but it's more going to, like, we were, like I said, there was a change in strategy, so we were talking more to providers, like you saw in the video as well. And with providers, we had like a long list of providers lined up, actually, one of them being Mount Sinai. With the benefits managers, we really haven't begun any talks yet, but we would soon be, like, after this week, I think we would start talking with them.
Gotcha.
Okay, and a follow-up of that question is, so currently, what kind of size of the company are you guys looking to serve? Is this like revenue, like in terms of revenue size, or or like just market size? Because I mean, like I want to ask this question because we want to make sure we serve a client that is we are manageable. I just say right. So just, yeah.
Again, I do know a few things, but I'm not the best person, but I'll show you what our long-term, short-term go-to-market strategy is.
Mm-hmm.
I don't think we really have a list of like really like a revenue specific thing as to what the company should be, but I would say we would probably like to start like small to medium scale, because it's going to still be a pilot program. Like we don't want to go to Google and roll out something which has not been tested thoroughly, right? So yeah, probably like start with like a small to medium scale size company with about like say 100 employees, or maybe like roll it out to like specific employees for that year, and then go from there. And I think it's a good time to like start it too, because I think October is the time when like benefits managers really start rolling out the new benefits packages.
Okay. And I also have another quick question. Again, just try to understand the whole process. Tell me if it's too technical. You know, I mean, I'm sure. I mean, I know none of us have the health care background, but when you build your, I guess, a questionnaire, or you know, like how credible it is. Like how do I convince, you know, how do I convince a company that okay, the list of questionnaires we have not only is accurate, but can truly help you identify some of the potential issue that the employee has.
Definitely. So all our questionnaires are actually based out of like very major regarded guidelines from CDC, HEDIS, American Cancer Society. And we also have like 2 physicians on board who actually create these flows for us. So we have like a very credible team, like, and they are the people who are designing this, and they would be also be the providers on support. So that it's very credible that way, since we're using those resources. Does that answer your question?
Yeah, it does. It does. Because I just want to make sure, again, I think it's probably going to be a question if we were going to work like together. We need to educate ourselves more, because if we're not being credible on our product, we can't convince them, oh, you should try to work with us, right?
Absolutely. And again, like there will be more people like giving you guys more like health guidance. Sarah is like the person, she's a physician, she's in Colorado. So she knows more about the healthcare industry. I'm more of like a product
the technical
person.
part. Yeah. Okay. Let's see. I just had another question. Oh, yeah. So we briefly touched the differentiator of your company. I think one thing you mentioned is your company provide an integrated platform that is somehow within the company's wellness, page or something like that. And you said that that's something currently is different from other company. Is my understanding correct?
To an extent, yes. Like most of the preventive companies in the space are like either they are individual, they're not logged into the benefits portal. That's number one. And number 2 is that they are not multilingual. And number 3 is that they do not have a direct provider support in that. So you cannot directly schedule appointments with a provider or talk to them directly.
Okay, so with your company, the employee will be able to kind of schedule a doctor appointment or something like that.
That's
eventually.
Right.
Oh, okay.
Yeah.
And then all of them will be considered in network, right? I mean, that's of course that'll be the the future stage, but that's the goal. Okay.
Absolutely. I'm not sure if this would help you guys, but this is like kind of like a screenshot of how our solution is going to look, if this helps you guys a little bit. But like this is like a screenshot of the mobile application, and they would have like a patient dashboard wherein they can see like, hey, you've completed this many screenings, these number of screenings are remaining today, take action on them. And also the provider information where they can chat with the provider, schedule a call or an appointment with the provider, things like that. And the next would be like this is how our screenings are going to flow. Like I was telling you guys, like based on their age and history, and then it would be more of like an interactive thing instead of just like a plain questionnaire, which is very boring these days. So it'd be more like a chatbot chatting with you. So it would create like a more private, intimate space for them also. Because I think when it comes to like medical history, people are not really very comfortable discussing it with random people, and like security is an issue. So
understandable.
If this helps you guys, yeah.
Yeah, no, these look great. This is great. Assist, inform, engage. I like it. Yeah, I mean, well, you answered all of my questions. I mean, yeah, Rudy, do you have anything else?
Yeah, I have a few small things that I want to just understand more. So for the platform, you mentioned, oh, okay, am I able to, so same like, if my understanding is correct, I'm able to talk with a live doctor in a way, or that's not the case?
No, you can talk to a live doctor. Yeah, that's
Okay.
absolutely right. In our long-term plans, we also have like our plan is to like expand to have like a call center which has like doctors, so you
Mm-hmm.
can like directly talk. Like the whole plan is to like make it as seamless as possible with as less delays as possible. Because right now it's
Yeah.
like the healthcare industry suffers from that a lot. You cannot get appointments. You get appointments months out. So we want to like
Yeah.
remove those barriers. Definitely.
Yeah, no, that's actually a great point. I'm being one of them who feels so difficult to just talk with someone. It's like, I just want to talk with someone, just have a small issue. I don't want to go to doctor, like office. And yeah, that's really interesting. I like that. And also another thing I want to confirm is, so you mentioned that currently you guys will, I mean, again, there will future stage and there's a current stage, but short term, you guys will focus on cancer. That's one of the big thing that you guys are, like doing screening about. And besides cancer, like also like a coronavirus, right? That's same like that's another one
Yeah.
that you guys are tracking. Is there another one that you guys are, trying to target at the beginning? Or
So I think that strategy we are still trying to formulate. So since this is going to be something annual, that does pose an issue because not all cancer screenings are like done annually. Like colonoscopy is recommended every 5 years, pap smear every 3 years. There is vaccination and like flu shots and HPV. Like those are also things that we're trying to expand into. But yeah, but like initially when we formed the company, our goal was to have like cancer screenings, what is the other thing? Sexually transmitted diseases screenings, as well as vaccinations. So those were the initial ones. And there are like a lot of such screenings that we can like really develop. But for now, the focus is just cancer.
Got it. And also in terms of like revenue structure, like what is your guys' plan on fee that you guys are charged to the companies? And I know this again, that might be something that's so far away, but I just want to get an idea about your revenue structure and how do
Oh,
you guys.
definitely a good question. Good question. So again, I don't think I am the best person to answer that. And I think people were still working on that. Like this slide was supposed to communicate it. Oh, wait a second. This must be the old one. I am sorry. I just have too many
Not
people.
a problem at all, Neha. No, this is great.
So I think there is something that somebody added, but I'm not very sure about it, like how it works. So let me do this. Let me actually write it down and make sure I answer it for you.
Thank you.
Like maybe by today or tomorrow about the revenue structure. Because this is something that I've worked on. I'm sorry.
Oh, you're only one person. You can't, it's like you have a team. There, like I don't expect everything. Nobody know everything, So no, don't feel bad or anything. And I think that's really all my questions for now as well. And so, do you have any questions for me and Spencer, Neha?
Sure. Yes. Absolutely. So first of all, like thank you so much. You guys are doing this for us. Like and like to get good positive feedback is like really good from fellow booties. So thank you so much. So I know like Professor Michael Alter had like outlined a few things, but I just want to know like what is the flow and at what points you would like need assistance with what, and accordingly like I can also plan and like just like a brief idea about how you guys are going to go about it.
Sure. So currently, we still need to take the meeting we have, talk with our team very quick and make a joint decision. But once we confirmed, which will happen, which I'm sure we'll give you a decision tomorrow, and whether how it goes, we really love your companies and stuff. The only if we somehow choose another company is only because we feel our skill set and not our knowledge align with that particular company more. So no hard feeling for that. But yeah, like we just need to, I think for now, we just need to talk internally. Once we make a decision, well, that's definitely let you know, which will happen in a day. And from there, I think we'll come up a list of questions that I think we will need to work with you. And also meanwhile, as we continue to talk, I think we will get more understanding about, like what company we want to reach out to help you understand the market better, to help you understand, what the benefit officer is thinking, and I think as we talk more, we can definitely have more discussion there. But eventually, yeah, we want to provide you something that you can take and help you slowly launch your sales department, I guess.
No, absolutely. Yeah. That sounds good. That's pretty good. Yeah, good luck with that. I can assure you this much, like, I know like healthcare is a very complicated space, but the team that we have, like they make it seem simpler. I am also not from this space, so I very much understand, like, oh my God, what a giant like, what is this? This is a maze you're getting into, but they make it very simple. And we have like a good team, like I keep mentioning. And we have like about 8 students, like, no, yeah, 8 booth students with us, and then one person works in Canada who's also like pairing up with me for the tech stuff, for implementing the technology, and then one physician who's like Sarah, who's supposed to be on this call. Yeah, and she's good too. She's amazing. So any kind of help that you guys need from like the healthcare perspective, like they would be able to provide you. They're really good at what they do. Just something like assuring you if that'll help you make your decision simpler. And yeah, since there are many of us, like any of us could always jump on the call. Of course, Sarah and I would be like the primary contacts. But at any time, like, you guys have access to the whole team. If you guys want to discuss more or have any questions, or, if you think you need more information to decide, feel free to reach out and I'll connect you with the right people.
Thank you so much. We really appreciate that. Spencer, you want to add anything?
No. I mean, I was just gonna say, yeah, thank you. I mean, thank you for sharing all of that with us, and being so very forthcoming and helpful. So yeah, I mean, at this point, we just need to kind of wrangle up our other team members, and get you a final decision as quickly as possible. But yeah, either way, I mean, like, sounds like you guys have a great thing going, and best of luck in the MVC. Yeah.
Great.
Thank you.
Great.
Yeah, you too, Spencer. Good luck with the social NVC. Yeah.
Thank you.
I need to do research, and hopefully I can still join that presentation. I think it's available to everyone, right? Everyone can join that meeting, right? Or only participant?
Which
I'm confused.
The new venture challenge. Do you know if they're gonna do it in like a web-based format, or?
Oh, the finals?
I think the finals are open to everyone. I'm not very sure about that, but I think all the internal presentations that we do, I don't think they are open to anybody except for the students enrolled in the class.
I would love to. It seems like there's a lot of great companies, and got me very excited to see what they do and everything. It's just great learning process, I think. But yeah, good luck on that, and we really think there's you guys are doing something great. You guys are trying to potentially feel and try to solve something challenging, make things more easy for patients, for employees. So yeah, best luck.
Thank you.
Yeah.
I really
All right then. Yep. Then we're gonna just let you have your wonderful Sunday afternoon, and let us know if you need anything, and we'll definitely keep you posted.
Absolutely. Good luck with everything, and yeah, be posted. Bye.
Take care,
All
everybody.
right.
Bye.
Bye, Neha.